Hello, guys.
Hi, everybody. Welcome.
Back to AI Live.
We have a really great show tonight for you guys, but we have some housekeeping to kind of get situated with first. But
Yes.
we wanted to welcome you here with us, and we love that you want to be with us because we really want to create kind of blend our art and science so that we can help you guys have that pathway into aesthetics and help you along the way as we learn along the way too. So thank you for joining us.
So how many of you guys are going to the aesthetic show? I'll be there.
I'll be there.
If you are, the Aesthetic Immersion is having their booth. We are giving away free things.
We are. We're going to be at booth number 700. That's like opposite of 007, 700. But we are going to be having these at our booth. And these are plastic cards that we had printed up with an anatomical picture on the front with the muscles. They're all, I don't know if you can see it, but they're all labeled. It's hard to see with the light. All labeled, the muscles and the veins and arteries, all the vessels. And then on the back, you have the protocol for vascular occlusion. I'm trying to make it so you can see it. I don't know if you can see it, but anyway, the protocol for vascular occlusion is all there for both non-ocular and ocular.
Something you should have in our office.
Yep, so you should have this in your office. So it's a nice plastic card. So this is a great reference. So we have 1,000 of these is all we have printed to take with us. So if you stop by our booth, number 700, don't ask us to mail these to you. We can't. But come by the booth and come grab some because we will be at the booth. We're going to be at the booth. He and I will be able to be in there a little bit on Friday. Try to be in there to meet everybody. So, but come and get those. Those are free, and we want you guys to just learn and grow and share.
Of course. And then, of course, our classes that are coming up. We have our Foundations of Advanced Aesthetics and our Foundations for our dentist. Let's see, we have July 24th, August 14th, and October 2nd. Unfortunately, those are all sold out because we really make sure that these are intimate classes and you get the most experience out of it. So those are already sold out, but you can get on the waiting list for any of those days. But we do still have one more for the end of the year. It's going to be November the 13th. There's still a few more spots left for that. So if you're really trying to jump into aesthetic medicine, this is the class for you.
Yep, it is. We also have, get in as soon as you can because we only have a few spots open on that one. We are having a Foundation of Threads course, which is really fun. If you already use the cannula and you've been a fairly experienced injector, this is a great course for you if you want to get into threads. So it's going to be on 9/11, so that's September 11th. So sign up for that, and that's going to be really, really fun. You guys have didactics to do prior to coming to these hands-on courses. So we do have homework for you before you get here that is required. So we send you all that information.
We spend a lot of time recording them, so watch it, get all the information you need, and then take the quiz, and then come to the class so that you're ready to go once we're here. Because that hands-on thing, we're going to jump right into it. And then the last thing is our CADS, our anatomy course. This is an amazing course. We just had it, last month?
Last month,
and it's going to be, again, put on with Dr. Codafana. It's limited to 10 spots, I believe.
That's it.
Because
that's all we allow.
He wants it to be super intimate. He wants anybody who is an injector to come, bring their questions. He's going to answer all of your questions. He literally starts the course asking every single person what they want to take out of the course. So what you want to learn, what anatomy you want dissected out, what you want to talk to him about, and all the freaking papers that he's published. I don't know how many papers he's published, but it's amazing how many he just keeps publishing and publishing and publishing. And it literally just changes the way you're going to inject and how you're going to approach your patient and make sure that you're going to get even better results.
Yeah, it's Professor Codafana is just, he's probably the only actual anatomist we have in the United States.
Yeah,
I don't know if we
that's
have
teaching injection anatomy. I think
that's
there are a lot of
anatomist.
them out there are more plastic surgeons
Yeah.
who do great jobs, but this is what he does day in, day out, doing his research, publishing papers. and I think he comes out with one like almost every month,
It's-
which changes the way we all inject based on.
It has changed the way a lot of us inject. It's changed, his research has changed the way a lot of us assess muscles, assess muscle action, and therefore change the way we do neuromodulators.
Yeah.
Change how we assess facial structure. It's very, very interesting. And he comes up with this stuff, and I'm like, oh, have you always been an overachiever? So we only have a 1 day. There's only 1 day we're offering this course. 10 people. So we have two of you each get a head. He does walk around, and he's with each and every person. We are with everybody. There is also an injection component where what you dissect, we're going to be able to inject on real people and kind of assess that and volumization on live individuals. And then we're going to go back in the afternoon and do threads on a cadaver head and then dissect that away and kind of look at the layers and planes. So really, it's going to be a long day. It's going to be an amazing day. So we only have, I think we only have, 7 spots open for that because we just released it. So sign up as soon as you can for that. And that's going to be here in California.
Yep, August 7th. It's a Saturday.
Yeah.
It's a full day event. All right. You want to jump into
So we're going to jump into tonight, you guys. Tonight, we have an amazing guest with us. Her name is Mimi Negron, and it says Jacqueline, but I know her as Mimi. She is one of the most inspiring people I've ever met in my life. She was and is my dental hygienist, and we kind of connected while she was doing my teeth, and she told me of her story and what happened to her and how she, through tragedy, has really become such an inspiration to so many of us. So I would like to welcome you, Mimi, to Aesthetic AI Live. Yes. So Mimi, kind of back up to before the night of the injury and tell us kind of what the day was like, what happened, what do you remember kind of up to the point of the accident?
It actually was one of my good friends from hygiene school was getting married, and so it was an exciting day. We were all of us classmates were going to get back together and celebrate something really exciting. And actually, on the way to the bride's one of the other bridesmaids' houses, I was actually rear-ended by a semi-truck.
What?
And yeah. And so anyway, we pulled over, and I'm like, what a way to start the day. And the guy was really nice. We exchanged, insurance information, and that was that. And I went on my merry way and went to the wedding and had a great time. And so my boyfriend at the time and myself were going to go up to Running Springs to go visit some friends that lived up there. And we were taking my car, which was the car that got rear-ended. And so he was saying, well, maybe we shouldn't go. We don't really know the condition of the car. And I said, well, I drove it here. It seems to be fine. So I talked him into it. And so we headed up the mountain. And we were not very far up the mountain, actually. We had just started up. And all of a sudden, around the corner came a set of headlights. And I said to him, they're going to hit us. And by the grace of God, he didn't swerve, because if he would have swerved, we would have gone over the side of the mountain. But he kept straight, and the drivers hit head on. And that was right after the seatbelt law was passed. So Mark, my driver, didn't have a seatbelt on. And there were 3 in the other car that were not belted in. So everybody was ejected. And I was the only one that was actually still in the car. And the car just kind of, I did have a belt on, but the car just kind of crushed around me. And so there was a gentleman and his girlfriend that were behind the car that hit us. And he said to his girlfriend, when they passed him, he said, they're going to kill somebody. And then they heard the crash. So they were brave souls. They came up he told his girlfriend to stay in the car, and I'm going to go see if anybody has survived. So as he's walking up, he's yelling, can anyone hear me? Can anyone hear me? And it's dark. There's no lights on this canyon road or anything. And I said, over here, over here. And I think it was probably very shocking that there was somebody speaking at the time. So he comes running over, and the next thing I know, you can hear all the sirens and and stuff coming. And he just held my hand the whole entire time. And then the paramedics got there, and I remember them saying, I think I smell gas. And I said, if there's an explosion, just leave me in here. I know what a burn is like. I don't want to survive a burn. No, don't worry about it. Don't worry about it. So the jaws of life, they fire up and they're able to get me out of there. And I remember just kind of reaching over, and I of course didn't film Mark in the car. And I said, where's my boyfriend? And they said, oh, they're working on him. They're about to take him to the hospital. Something in the back of my mind told me that wasn't the truth. So I'm thinking to myself, he's got to be more serious than myself, and I don't hear helicopters, I don't hear sirens going anymore. So anyway, they ended up putting me in the ambulance, and I was conscious enough to tell them where my parents was, gave them the phone number, and it was just, so they take me to the hospital, and you can hear all the confusion and everything going around. I was newly graduated hygiene, and so it was a rotation for a lot of the residents that were from Loma Linda. And so I got a first-year resident, kind of wet behind the ears, and he comes in, finds out that I'm an alumni, just newly graduated. And so he, tried to calm me down, just said, everything's fine, your parents are on their way. And so anyway, never, ever told me the extent of my injury or anything about Mark or anything like that. So my parents get there a number of hours later, and between the doctors and my parents, decided not to tell me about Mark until after surgery. So they told my parents, kind of set my parents up, that they thought that I would probably lose my sight in my left eye, and they had no idea the extent of the injury to the left side of my face. I had completely fractured my left leg in multiple places. And so there were going to be multiple teams working. There was going to be an orthoped working on my leg, ENT on my eye, and then plastics and reconstructive on my face. So they did a reconstruction for about 12 hours that night, just taking all the debris out of glass and broken fragments of bone. And when I was really, got out of that operating room, they still pressed my parents that they weren't sure that if I was ever going to be able to see out of my left eye again, and said it's going to take multiple surgeries to reconstruct her face. So when I left 2.5 weeks later, I had no bone in the left side of my face at all. I completely blew out the orbital rim, my cheekbone, my nose was gone. The only thing was left was the soft tissue. So they basically just stitched me up and sent me home, and waiting for other things to heal and for my body to heal in order to go back in and reconstruct.
Wow. So the doc that was on call, or the plastic surgeon that was there, there were two. There was one that was on call that works out of Riverside, right?
Right. There were three. There was an oral maxillofacial, there was an oral maxillofacial resident, and then there was a plastics.
Okay.
So yes, he had the plastic surgeon had a practice in Riverside.
Yeah, and that's the one that I've met.
Right.
Okay.
Right.
So you had the first surgery, and you had your leg in a cast.
Yeah.
Gosh, and your face was halfway not there. So,
Right.
so after this, how long were you in the hospital? Then you got discharged. Then you had to go back later for more surgery. So what was the time in between for that?
About 6 months.
Okay.
So I was newly graduated, and so I was anxious to get back to work. And looking back on it all, it was probably the best thing I could have done. As soon as because I had been working for about 2 weeks when the accident happened, and my boss was kind enough to keep my job.
Oh my goodness.
And so I went back, and when I saw some pictures of what I looked like when I went back, I thought, well, I guess it was a good thing that you wear a mask for a living, because I literally looked, I had a big old fish eye, and my nose was like a ski slope, and since I had no bone here, it literally was like just caved in, like severely caved in. So, but it was the best thing I could have done.
Yeah.
It was a healing it started the healing process.
So one of the residents that worked on you.
Yes.
Ended up being someone special.
It did. He certainly did. Yes, I remember that my first reconstructive surgery about 6 months after the accident. Obviously, I had multiple post-ops between that time and the time of my next surgery. And I think just joking around, I started calling him by his first name. I probably was very disrespectful, but I did it anyway. I was a little
young.
I was a little sassy back then.
You're like 18 or?
I was 23.
23. Okay.
Yeah. And so, yeah, I just started calling him by his first name, and my parents were just like, you can't do that. You need to call him Dr. Fox, you know? And so anyway, we became friends. And so my first surgery, I remember after I woke up, I remember him coming to get me to, you know, to have the CAT scans and everything. And I thought to myself, isn't that what, like, nurses do, and like the residents don't take the patients to get, you know, this done or that done. And then that stay, I was there for about 2 weeks after that particular surgery, and during that stay he brought me dinner from a local restaurant, and so my parents were like, and I'm like, no, he's just really nice, and, you know, he just cares for his patients, and so unbeknownst to me, it was the beginning of a very special relationship, and in 1990 we were married.
Isn't that wonderful?
Yes.
Wow.
So
Oh my gosh.
broke all the rules, right?
Right.
I was not thrown out of school, which was a good thing. But yes, we got married in 1990. So.
And he ended up being a oral maxillofacial
surgery.
surgeon.
Mm-hmm.
Okay.
Yeah. So we got married in 1990. Our son was born in 94, and our daughter in 97. So yeah, two beautiful
awesome.
children, and yeah,
That's
that's wonderful.
awesome. Well, I wanted to, so you guys kind of have an idea of what Mimi went through. I wanted to show you, we have a few slides. These came from slides. Real
Slides. It really dates me. I didn't give the date of the accident,
These
but
are from slides, yeah.
slides, and then the hairstyle really.
Yeah. So these are a few. So we'll pull up, go ahead and pull up the first slide, you guys. This is the probably the night of the
That's
trauma?
the night of the
Okay.
the night of the accident. Yes, it was taken obviously shortly after intubation, and they were ready to rock and roll. That was about a 12-hour surgery, and like I said, they basically just debrided everything, glass and bone fragments, and everything was completely shattered. So they basically were going to start from the floor up.
Wow.
Yeah.
Was your jaw broken also?
No, and not even a tooth.
Wow.
As
Good
a
thing.
new, yeah,
Dental hygienist.
As a new dental hygienist, not even a tooth broken. And actually, I believe Michael said that that I actually made some of the medical books because of the facial fractures, and not having a jaw fracture was very unusual. So, but my maxilla was in place, and so was my mandible. So I was very fortunate.
So were they thinking, didn't you mention that they thought that you may have hit in the gear shift knob
Right.
or something?
Yeah, right. It was a stick shift car, and they think that I like maybe turned away from the light, just natural reaction, and hit my face onto the gear shift.
Yeah, which would why make it more localized.
Right, exactly. Okay. Yeah.
So we'll go to the next photo, and then maybe you can kind of tell us.
Oh, okay. There's the hairstyle. Yeah, that's the late '80s right there. Oh, and I think that's pink lipstick. I'm not sure what that is. And the earrings. Anyway, so that is in the 6-month period where you can see very deficient on the left side. That's actually probably a pretty good picture.
Yeah, I was saying,
because
was that bad?
yeah, it was a lot worse than that. So that was towards the end of the healing before they went in. And each time they went in, they revised the scar also up until the 3rd surgery, and then they decided not to do that anymore.
Really?
So
Okay. Go to the next photo, you guys.
yeah, there you can see a little bit more the deficit in the hair.
And this is something that that I worked on with Mimi too, is that you can kind of see where she has just kind of global weakness on that left-hand side,
Right.
which led to some of the facial asymmetry with motion or with contraction. So
Right.
we've kind of addressed that, and I'm going to have them bring that other photo in, the before and after that is in Mimi's book. Have them bring that in. Okay, go ahead with the next one.
There we go.
That's where you see a little bit better.
There we go.
Where you see it,
So I think the ones previous were probably more healed, and this is the one you can see the little ski slope nose and the complete difference between the left and the right side.
Yeah, where there's like no zygoma.
Right.
Yep. Thank you. And then.
And that is an after picture. So that would be after my first reconstructive surgery. They took iliac crest from on the first surgery, which this is that, and they rebuilt my nose and my orbital rim. We went back and forth, not we, but the doctors went back and forth whether to use rib or iliac crest. And when I heard the words chest tube and things like that. I said, I'll go for the iliac crest. And they said the problem with that is that it resorbs more readily usually. So that was a risk that we were taking.
Okay.
And sure enough, years later it did. And so I needed a second surgery, and they did a cranial flap. They cut me from ear to ear and took a big chunk of my cranium. I think
Wow.
Yeah, and they went back in and did more reconstruction.
Wow.
So, and that time they actually went through the scar. Yeah. So.
Oh my gosh, you've had.
I'm the bionic woman in
You
a
are the
really
bionic
weird
woman.
way.
Okay, let's see if we have another. There we go.
Yeah.
your,
So there's the. Oh, okay. That's the cheek graft, I believe. So that's a metal plate. And I believe that's the one where they use the crest, the iliac crest, and to
make it look like a zygoma.
Right, exactly.
Okay.
Mm-hmm.
Wow.
There we go.
There it is.
That's a great picture. So that's the second surgery.
Okay. So as injectors, we are concerned about injecting over a graft or injecting over an implant. So that was part of my concern with you is I don't want to be anywhere near
All of that.
all of that because it's a high risk of infection and problems. So kind of go forward now. You and Dr. Fox got married. You
Yes.
had kids. You were seeing the first surgeon for a while, and he was kind of doing things. He was doing-
Right. So the surgeries were all over. We couldn't. There really wasn't anything more they could do bone wise. So years went by, and everything appeared to be fine. I mean, like anything else, nothing lasts forever. Oh, and then age sets in. So you start aging. And the left side, I really didn't have any fatty tissue. I didn't have anything left because it was in complete blowout. They basically just stitched the thin skin across the grafts. So everything started to really change. The left side of my face started to appear much different than the right side of my face. And Michael was a little concerned. He definitely said, you know, we need to look into to doing some corrective work, whatever that may be. Thinking more that we'd be able to get away with maybe more soft tissue grafting and not necessarily have to do a large bone graft again. Mm-hmm. So that was kind of where we were headed, and then our life changed radically.
Yeah. So you're happily married with 2 kids. What happened?
Yes. So then in 2002, my husband, 42 years old, had a massive heart attack. And I was at work, and I got had just gotten off work, and I got the call. And he had small episodes leading up to that, so I really thought when I got the call from the neighbor that I would arrive and the ambulances would be there and the paramedics would be trying to convince him to go to the hospital. Well, I walked into something much different. He was in full arrest, and they were in full CPR with a flat line, basically. And so I was yelling and screaming, and they basically just picked me up and moved me away and took him away. And so I followed the ambulance, and the neighbors came to sit with the children, and I had a decision to make. We needed to airlift him to another hospital, and so we airlifted him to Fullerton. And years before that, he had been treated out at Scripps Memorial out in San Diego, and I really wanted him to go back there, but we didn't have the time. So we took him to Fullerton, and he was in a coma for 3.5 weeks. And but I knew he was going to wake up. I didn't know what we were going to have, but I knew he was going to wake up. So he did, and he was in the hospital for 4.5 months. And my family and my friends just rallied around him, and my kids and I, that was our second home. My children were 5 and 8. Oh. And our life didn't stop. They were involved with ice skating and hockey and gymnastics and started golfing, and we just made that our routine. You know, my mom retired, and she came and would spend the night with my kids, and I would put them to bed and do homework with them and then go back to the hospital, and we did that for 4.5 months, and then we were, by the grace of God, got to bring him home. So we brought him home, and we started all the rehab at home, PT and OT and speech, and he recognized us, thank God. He knew who we were. He knew that I was his wife, and he knew the kids, and his speech we could understand. Most of the people couldn't, but we could understand him. And he just still had that wonderful personality. He would still smile, and he knew dentistry still. He knew oral maxillofacial surgery still. I used to bring him home X-rays to test him, you know, and he would say, "Oh, that implant doesn't look so good," and you know, just stuff like that. Just was still, it was amazing. And then in 2003, he wasn't feeling very well, and so I called his doctor, and his doctor said, "You know, I'll meet you at the emergency room." So my friends came and helped me get him in the car, and we took him to the emergency room. And that next day, my daughter was going to be a flower girl in a wedding. So the doctor said, "You know, we're going to do a nuclear scan on him because they had put a defibrillator in, and we have to sedate him. There's no need for you to be here. So you go ahead and take your daughter to the wedding, and we'll call you when he wakes up, and we'll go from there." So I was halfway to the wedding with my daughter, and I got a phone call that he had coded. And so I dropped my daughter off, and with really, really good friends, and explained it really quickly. And then I just jumped in the car, and I got to the hospital. And still to this day, I don't know how, but the waiting room was full of all my friends and family. I don't know how they found out. And the doctor came out and said, "You know, everything we're giving him to keep him alive is keeping him alive. And there's pretty much nothing else we can do." So we called his mom and his sister, who lived in Chicago, and they were able to get to the hospital, and we got him in to see him, and they had a moment with him, and they walked out, and the second the door shut, he coded one last time. And so he passed away in October of 2003. Wow. So my babies were 5 and 8, and I wasn't sure what tomorrow was going to bring.
Right.
So yeah, it was a horrific, horrific time in our life.
So he was an inspiration to you.
He was.
In more ways than just being a husband.
Yes.
He changed your life.
He did. I saw what a fighter really looked like. He never gave up. My daughter used to sit with him at the table, and she would say, "Daddy, louder." And I remember saying to my mom, "She's going to be a therapist of some kind someday." And she's just months away of becoming a doctoral in physical therapy. So he changed all of our lives. My friends' lives, my friends' children's lives. He was a rock star. And so after everything started to calm down, and I started to get my feet on the ground, and it was all God. It had nothing to do with me. It was just being surrounded by friends and family and my children. And so all the dust started to settle, and I just remembered Michael always saying, "You know, you need to take care of yourself. You need to make sure that you take care of yourself." And it just kept ringing in my head. And the last thing I wanted to do is scare my children with more surgery, or to be put to sleep, or to, that. So I really, 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 really drug my feet in going and contacting the team again. Mm-hmm. And it was years later. My husband passed away in 2003, so this was 2008. And it took me about 2 months to call the office. And I finally did, and then I hung up. And then I called back again, and the lady that answered the phone, actually, I think my voice was kind of quivery, and she asked me if I was okay. And I said, "I just would really like to come in and talk to Dr. Hardesty again." And she said, "Oh, of course." So I made the appointment, and I went in. And I had given her my name, and she recognized the last name because of, he was also an alumni of the school. And so I get in there, and she says, "Were you hurt on a canyon road in 1987? And I said, "I was." And she said, "That was my first day at Dr. Hardesty's office." Wow. And she basically just took me by her side and was by my side for the next 3 years that I was in partnership with Dr. Hardesty, and decided to go in and do another minor surgery compared to everything else that I had done. It was about 7 hours, but it was all soft tissue. Mm-hmm. And used a little ear cartilage, and used a palate, all kinds of interesting things. So that was in 2008. And so I was under his care probably for the next 2 to 3 years. Yeah, and then he introduced me to Sculptra and things like that when he started to use fillers where we could he didn't want to touch my nose. He was too afraid to re-break the original graft. Mm-hmm. So we left my bridge alone. And Betty started using, the fillers in all the other areas to try to, for lack of a better word, fill in where all the void was. So, yeah, so that was up until about 2010, 2011.
Yeah, then here's where we meet.
Right.
Here's where we meet when I was getting my teeth cleaned.
Right.
And I tell Mimi what I do for a living, and hey, if you want to ever come over and hang out, you can. And lo and behold, one of these days, she said, let me know what you can do. So she came to our office when I was working in Rancho with Dr. Kwok at the office, and when she came in, I knew she needed some fillers, and I was a little hesitant because I know what's under there, and I want to be very, very careful of what goes under there next to any implants. And I remember I thought, oh my gosh, Lift would be perfect for her, like a hyaluronic acid filler, just put something in there to give her a little bit of volume, and she'd love it. And I remember walking out and asking our rep first, and I said, I gave her a quick call, and I said, you know what, is there any way we can help this? She's a trauma victim. Is there any way that we can help her? And she's like, absolutely. So I went back in, and we put like 3 syringes or something, not a whole lot. And I will never
Still makes me.
I'll never forget your response, because it makes me realize how much we touch people's lives. And Mimi looked at herself in the mirror and just started crying.
Again. Every time.
And just started crying. And she said, oh my gosh, she was so grateful and so appreciative of just something little that we kind of do every day, and we don't realize that. She said, Lori, she goes, I don't mean to belittle you at all or anything, but she goes, you need to be doing this at a different level. Like, you need to be doing this for people who have injuries, because it can change lives. And you were my inspiration to start the nonprofit calling Fulfilling Faces, which is kind of after Mimi, to help victims of trauma and stuff. So you are totally my inspiration, and it's been awesome to help people like that. But I was going to show, this is in 2013 when she came. I don't know if you guys can see this or not, but on this side is when she came in to me, and that's just with a few syringes of filler. Can we see that? There we go. There we go.
I remember calling you. I think you were driving home.
Yeah.
And I think it was just newly illegal to talk on the cell phone. I slightly remember that.
Probably.
And I said, Lori, why don't I need you to pull over, because I have something I need to tell you. And I said, what you do, making beautiful people more beautiful, is unbelievable. I mean, the before and after pictures are unbelievable. But there's so many, and not to take anything away from that, but there's so many people, I'm just one of many, who have reached the end of anything that could possibly make them look normal again, as far as aesthetic surgery. And I had no idea what fillers, anything about fillers or the magic of them. And not only was I dealing with lack of, collagen, obviously with the aging process and everything like that, but then, just the symmetry was gone, was completely gone. One side being a lot stronger than the other side, and just things that, was my confidence in the ability to be myself was going down quickly. And you just, and your magic just changed my life, and your heart of caring for people and loving on people, when I was really at a point where I didn't feel loved. Like, I didn't feel like everything that I loved had been taken from me, and I still had 2 babies to raise.
Yeah.
So anyway, I could talk for a lot longer than an hour, but God was just so good and just sent so many amazing people into my life, and you are at the top of the list.
Well, thank you. I just feel like it's God puts us in places that we can use our talent and skills that He gives us in the first place.
Yes.
To help others. And I think being doctors and nurses, that's what we want to do. And this is the epitome of using something God has given me to help somebody else. And that's why you have touched my life so very much.
Having the gift you have is one thing, but having your heart is another, because people can be very talented and very gifted and very successful, but if they don't have a heart to help others, to me, it's wasted. And you are the epitome of always just, your arms are just always open wide and always just, I feel it's people ask me, because I'm very involved in a program called Grief Share to help others who have lost loved ones. And people ask me all the time, does that hurt to bring all of that up? And you can see it's still, 17 years later, still very emotional. And, but I always said, if my story can just touch one person, whether it to give hope, or maybe to other practitioners to show that there's just so much more out there. The magic of medicine is unbelievable, and put in the right hands can change lives. And you both of you do that every day, and in the pictures that I see are unbelievable. But there's just so much. There's so much more, and I've always told Lori, if I could just be a small part of that,
Yeah, and so I want to continue that nonprofit. It's pretty much in your name, it's because you're the one that inspired that for people who.
It's exciting.
It means more than just a wrinkle.
Right.
It's symmetry. So I want to fast forward a little bit. So after we did a few sessions, we did some sculpture and we did some fillers and things. We kind of just through the years, just kind of fine-tuned, nothing crazy. Mimi's been someone that on my Instagram, you'll see her kind of on my Instagram a lot, because when she comes in, I like to talk a lot about asymmetry, because she has one frontalis that lifts up strongly, one that's weak, one, bicular arcuate that contracts a lot, one that's weak. So I really kind of, it's almost like a Bell's palsy, where I kind of relax the overactive side to help it match the hypoactive side. So she's my learning, my little learning tool. But I share a lot of that, and Mimi's been so sweet to let me share that with how we assess patients and such. So fast forward, we've done just a few things through the years to just kind of help you just maintain and tool along and keep looking beautiful. And then Mimi let me know about a Christmas card that she sent out.
Yeah. So which one are you?
Like your picture.
Yeah. So the first picture, because back in the day before the phones had cameras, people would bring cameras out, and I would literally run. Like literally didn't want to be in front of a camera, didn't want anyone to take my picture, didn't. Besides my friends and family, I really didn't do much. Of course, I was raising 2 small children, so that kept me plenty busy. But I really had no desire to have to be a part of the world, so to speak. And then the kids kept saying, we need to have a family picture, and I'm like. So, they were old enough to be very persuasive. And so I said, okay. So we sat down, we took a family picture, and it was the first picture that I looked at and I was okay with. Not only okay feeling comfortable to look at it, but okay to send it out and have other people see what I look like. And from that moment forward, you gave me confidence that I never had all of those years, from 1987 to that point. And including my own wedding to Michael in 90, the pictures were very difficult to take. They were very difficult to look at. Because I think as survivors, it's the first place our eye goes. That's why when I come to see you, I always say, what do you see? So because that's important to me. You are the professional, and because our eye always goes towards. I remember one of my very best friends. After I told her the story, she said to me, "Oh, I didn't even notice, but now that you called my attention to it." But since our eye is always on that, it is our attention.
We always look at our flaws.
Right. So that kind of started the ball rolling. Yes. I started feeling like a person again. And then in 2015, I remember it like it was yesterday. I was sitting in church, and there was a guest speaker, and he was an older gentleman, and he was talking about how his wife had passed away and how he had gone online to eHarmony, and he was reluctant to do that. He was older, and the computer dating thing didn't really seem like his thing, but he was kind of getting pushed by his older friends, and so he did, and he told the whole story of how they met and how they everything, and I just felt like this, for the first time, I felt like this thing in my heart that just told me, you know, God doesn't intend for us to be alone. And so my son at the time worked at the church, and so later that day he came home and he said, so what did you think about the message? And I had kind of been thinking about it, but I thought, oh, my kids are going to go like, oh, Mom, like, first of all, you don't even know how to turn on the computer, well enough, you know, like, do a profile, like, do you even know what that is, you know? Then they were very right, you know, all of that was true. But anyway, so so we sat down and we talked about it, and I said, so what do you think about it? And he goes, could you please hurry? Could you please hurry? It's time, Mom, it's time. It's been 17 years, Mom, it's time. And so I thought, well, he's one, but my daughter is another. So we had another conversation later that night. She wasn't quite as quick to say, let's do it. But she looked at me with a big smile on her face, and she said, if you need help making your profile, be happy to do it. So that was in 2015. And in 2016, the Lord blessed me with an amazing man. In 2018, I got married.
Yes, you did. And he's wonderful. He's a wonderful guy. And this is it's come full circle, you know? It's come full circle. And
it truly has.
You've just got the strength of somebody I've never seen before, ever, to get through this with the kids.
It's all God. It truly was God, and I just am every day thankful for all of the people He put in my life. And you, Lori, I hope you know, being a part of my wedding was one of the most special thing to me. All the people that walked down that aisle that day to that special song are people that have rallied behind me and just kept me going. And you and Brian were such a big part of that. So I'm so happy and proud to sit here. Because if I can be just a small cheerleader of the two of you, I'd be happy to do that. If I can just give one person hope out there that looks in the mirror and just is afraid to go outside is what I'm about.
Yeah, it's so, do you see why Mimi's my inspiration? She's my inspiration. And I think that's so true. I think it's so true that we sometimes take so much for granted, and we might have friends out there, we might have family out there who have had, it could be surgery, it could be like a cancer surgery, it could be something,
anything,
a trauma, it could be anything that we as medical aesthetic specialists can really help them, and we can make a difference in their lives. And sometimes it's not just Botox, it's much, much more than that. And thank you for opening my eyes up and showing me what a difference, I can make. It gave me a whole new look at what I do, that it's not vanity, it's self-esteem, it's confidence, it's all that. It's not vanity.
I remember the first time I met Brian, your husband, outside of the office, because Brian doesn't really like the dentist, so I don't get to see Brian. Where's Brian? Where's Brian? I don't really get to see Brian very often because he stays away from me, the dental office. But we had dinner one night, and I remember telling him I had just started the dating process, and I remember telling Brian that how afraid I was to date. And I remember him looking at me, and he's like, "Why?" And that was the moment I knew that I saw something different that other people didn't see, and that was because of you. What you did for me, that comment to me showed me that what was going on was working. Like, people weren't noticing it. Like, I remember walking into restaurants telling my mom that everybody stares at me. And I remember her saying, well, do you think maybe because you have pretty eyes? And I said, no. Like, that wasn't even something that I ever thought of. And Brian saying that to me, I remember driving home that day, having so much more confidence that, you know what, I think I can do this. If my kids can teach me how to figure out the computer, I think I can do this.
Right.
So yeah. So I mean, and those are things you don't forget. You know, you just don't forget it.
You don't.
No, I mean that was years ago, and yeah. So thank you.
That's what I'm here for.
Oh.
That's what we're here for.
Yeah.
This is so. I hope this has touched you guys. Mimi's touched my life, and what an inspirational story to go through this trauma and to go through so many surgeries. How many surgeries did you have?
So three reconstructive surgeries that averaged between 14 and 16 hours long.
Wow.
And then 2 to 3 weeks in the hospital after each one. And then the minor surgery with Dr. Hardesty in 2008. And so that surgery was my last surgery, thanks to you and your talent. That's something I don't, that I will never walk down that road again. But I'm thankful for everything that happened and when it happened. But yeah, so it was a very long road.
It
Very
was.
long road, yeah.
And you
And
made
those
it.
pictures, I just thought, ooh, the hair.
We know what year it was.
Yeah,
I think we all had
yeah.
hair like that. Oh my gosh! So if you guys have any questions, go ahead and type them in. We're seeing we're some wonderful comments. Thank you, everybody.
And I just wanted to say too, obviously they all have connection with you. If I can be of any service to anyone that is watching tonight, Lori can give you my information. I would love to chat with anyone that, if I can help, I always say if my story can help one person,
Right.
The journey's been worth it. So.
And it's taken a truckload of faith and perseverance.
Yeah.
And Michael was a Christian, but you weren't.
Right.
And
That's a whole nother
brought you-
live stream.
Right, a whole other AI
That's a whole other live stream.
But
Yeah.
it brought you to
Yes.
the Lord.
Yes,
which,
yes. I accepted Christ. Michael was in very, 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 very bad shape. And I remember walking to the hospital room and him looking at me and saying, I'm just praying for God's will. And I'm like, what does that mean? And I went hysterical. And so much so that they escorted me out of the hospital. I was accusing nurses of drugging my husband and all kinds of crazy things. And I found myself alone in the parking lot of Scripps Memorial Hospital. And it was the first time in my whole entire life that I'd ever been alone. Wow. My family and friends were always there with me, always around me, my children. And I literally looked around and I was by myself. And I feverishly tried to find my phone to call a pastor friend of mine that I was just slowly dipping my feet in the water of the Word. And remember reaching out to him and just ranting and raving the treatment that I was getting in the hospital and Michael and all that stuff. And so he listened to my ranting, and then he said, so you ready? He used to call me Fox. That was my last name at the time. And he said, are you ready, Fox? Are you ready? I said, ready for what? He said, are you ready to give your life to the Lord? And I said, oh, I believe in God. He goes, no, are you ready to give your life to the Lord? And I said, absolutely. And he led me through the prayer of salvation, and my life has never been the same. I've been on fire for Jesus ever since. So, yeah, I've been blessed enough to give testimony at many churches and get-togethers, and it's just, again, I always promise if my story can help one person in their walk of faith, or one person in reaching out for help and trusting people.
Right.
Trusting people. Yeah.
Taking that step.
Taking that step.
So one thing is just don't be afraid, because there are people out there that want to help you. There are those of us out there that we love doing what we're doing, and we want to help if there's any way we can. If you know somebody and
and if
that's going through a tough time.
Yeah, and if I can be at help at all, Lori can get a hold of me.
Got her number.
Yes, absolutely.
So I just want to, here's a couple questions, just as we're getting kind of tight on time, but Farina, Lori, which level did you inject the fillers in? Good question. So it's been over a few years that I've done things, and sorry, that was me. And with Mimi, I have used some cannulas and done some subdermal, say, fillers up in this area. We've done some temple fillers. We've done a little bit of nasolabial. We've done a lot of Sculptra. I've done a lot of biostimulation, more on the left side than the right. The left side was very volume deficient, so the left side needed more of the fillers and more of the biostimulants than the right to try to help give even proportions. So I was real hesitant. I think a few years back, she talked me into this. A few years back, I probably put a couple little drops of filler in her nose area, which you don't know what you don't know.
But the picture,
and it looked great.
Oh, yeah.
And she's asked me, like, can you do it again? I'm like, no, no, I'm not touching it. Like I said, you don't know what you don't know. But anyway, put a tiny bit of filler there. We did some CO2 on the scars and resurfaced some of the scarring. So mainly Sculptra and some hyaluronic acid fillers, mainly in that left-hand side to kind of bring that up. But I'm very, very, very cautious about getting near the implant. I want to always stay away from that. And the other thing is when I do your temple, I'm like, I don't know what's in there because everything's moved. This anatomy is not the same as this anatomy over here.
And
this facial anatomy is not anywhere where we think it is. So
and it's very
really
true
careful.
because I actually had to have a crown done on my upper tooth. And when they gave me the injection, first of all, I couldn't get numb. And second of all, my mandible got numb.
Yeah,
Which
your nerves are all
anatomically
switched
is
around.
not possible.
Wow.
So I don't only make you nervous, but I make all dentistry nervous also.
Right.
So yeah, so it was crazy,
Yeah.
So it's a mess over there.
It does. See,
It's
yeah, my point exactly. So she just proved it. So if somebody has surgery and nose, face, things are not in the place where we thought they would be. So not only do we have huge anatomical variations innately, but when somebody has surgery or trauma, it's all bars are all bets are off. All bets are off. It's anywhere. So I like to use a cannula on her because I'm always super gentle and I let the tissue let me through, and be super gentle and kind of. Tiptoe. I tiptoe.
I take poor Lori's a lot of Lori's time.
I tiptoe, but I want to be careful. So you guys have just made such wonderful. Thank you for so many wonderful comments. Says, would Sculptra work with no tissue around? She is amazing and beautiful. Yes, you are, girl. Sculptra works very, very well subdermally. So if there's not much fat in there, it'll help build subdermal collagen, type 1 and type 3 collagen for the most part.
Yeah, for sure.
So, and we use a lot of biostimulants.
Yep.
Yeah, the hypervolute radius and such.
Love that one.
Yeah.
Have to try that next.
Yeah.
Have you guys ever seen
To
him so
try that
quiet?
out.
He's so quiet.
I gotta do he gets to do all the talking. It's great.
But we're out of time, aren't we?
Out of time.
Okay. See what happens when you invite me, Lori.
I know. See, yeah, so I could listen to you all night long.
Seriously.
So go ahead and.
All
There
right,
you go.
so I think we are doing another contest. This time frame is from today to the end of the month. And there will be one winner, and you will get your webinar of your choice. So we have a bunch of webinars that we are going to be doing, and we have a bunch of webinars that have already been done. So you get to choose one of them for yourself and your educational purpose. So how to win? Just make sure that you follow us at the Aesthetic Immersion, tag a friend that would like to watch AI Live, and then our next AI Live, we will be announcing it. So our next one is going to be August 3rd at 6:30. So we will. I don't even
And
know.
who was our last winner? Who was our winner
Oh,
from last
our
time?
last winner. That's right. It was Marissa Bond. Congratulations, Marissa. We hope to see you at the Aesthetic Show because she won two tickets to the Aesthetic Show, and Lori and I will be there.
Yes,
so
we will.
drop by the booth and say hi. Was it booth 700,
700.
right? 700.
007 backwards. 700.
Other than that, make sure that you join us next time on AI Live. It's going to be a very interesting talk. This is the one that Lori is super passionate about. It's, are you aspirating long enough?
Are you faulty aspirating?
So-
So you better tell everybody to watch this.
We're going to be going
I have a
live.
huge issue with faulty aspiration. You think you're clearing your needle of product, and you're not. So we are going to go through all the products. So please tell your friends, all your colleagues, to get on to the next AI Live, because this is something near and dear to my heart that I think we really need to learn to aspirate correctly. It's not as easy as it looks with all the different products we have available to us.
So we'll see you next time, August 3rd, at 6:30.
Thank you, Mimi. Thank you so much for joining
My
us.
pleasure.
Thank you
My pleasure.
so much.
My
Amazing
pleasure.
story.
My pleasure.
Thank you. Thank you, everybody. Thank you. We'll see you next month.